So because we are talking about gram-negatives now, the first thing to remember is, again, of course, that the gram staining is going to be red colored rather than purple. Remember, purple for positive, so red for negative. And because we are talking about gram-negatives, they are gram-negative because they do not have the peptidoglycan in their cell wall that we've been talking about, and therefore the cell wall antibiotics are not going to work as well on these guys. Being as they still have some peptidoglycan, they are susceptible to certain cell wall antibiotics, but only specific ones that work on gram-negatives. So a couple of the cell wall antibiotics like penicillin G and vancomycin absolutely do not work on gram-negatives. So we can just forget about those entirely. The same way that we spoke about the gram-positives, we started talking about the cocci and then the different kind of bugs from there. We're going to approach this pretty similar style with this lecture. So we're going to begin first talking about the gram-negative cocci. And it's actually a pretty easy group to think about because we're only worried about Moraxella and Neisseria. And Moraxella is going to be a dead giveaway on the presentation. You know, we're going to be thinking about Moraxella typically causes like epiglottitis or otitis media in kids. So that's going to be a very typical presentation for Moraxella. So it's going to be more interesting to talk about Neisseria. And Neisseria, you know, there's two kinds. We think of meningitidis and we think of gonorrhea. So the first thing we have to know is that they are diplococci. They have an IgA protease, which allows them to bind to mucous membranes. And again, that's going to be very important for us because Neisseria gonorrhoeae binds the mucous membrane in the urethra, and Neisseria meningitidis, it gets in through the mucous membranes and then it's able to get systemically through to the CSF and cause meningitis and diseases of that nature. Our first slide shows a picture of Neisseria meningitidis on the left, and it's from a CSF sample. So we see a couple diplococci in the middle of the screen, and the picture on the right is a picture of a urethral swab of gonorrhea. So we see tons and tons and tons of neutrophils, and we see a bunch of these neutrophils have phagocytosed an enormous amount of bacterial material, and it's a little difficult to see in this picture, but they actually are diplococci as well. So a couple of things we have to know about meningitidis versus diplococci from the perspective of culturing these guys. Gonorrhea ferments only glucose, which is why it starts with a G, G for glucose. Meningitidis, on the other hand, starts with an M, so it ferments maltose. It also has a G, so it ferments glucose as well. So when we think about gonorrhea, we have to know a couple things. Number one, there's no capsule. We can't be vaccinated against gonorrhea because it has very rapid antigenic variation with its pilus. So being as that's the most immunogenic portion of the bacteria, there is no one antigen that you can just make a vaccine against and that'll be it, because it actually has a gene that allows, kind of random antigen formation on the pilus. The diseases that it causes are urethritis. We already spoke about that. It's always going to be symptomatic in men, pretty much. It causes pelvic inflammatory disease in women, and it also can cause septic arthritis. So when you think of a reasonably healthy, sexually active person coming in with a single joint that's inflamed and painful, that should be a dead ringer for Neisseria. And it also causes Fitzhugh-Curtis disease, which is a syndrome that causes infection of the liver capsule. And so the buzzword to remember is violin string adhesions between the peritoneum and the liver. When we think about Neisseria meningitidis, we remember, of course, that it ferments glucose and maltose. It is capsulated, so it's one of the Shin bacteria that we worry about in people with splenectomies. You can have a vaccine against it, which is why when you entered college, you had to get a vaccine for Neisseria meningitidis before you were allowed to live in the dorms. It's transmitted via respiratory droplets, which is, again, why it's important to be able to cross mucous membranes with that IgA protease. It does cause meningitis, and it also causes Waterhouse-Friderichsen syndrome, which is caused by meningococcemia, meaning the meningitis bug gets into the blood. You get septic spots all over the body, which are basically nothing more than a rash due to small hemorrhages. And you also get bilateral adrenal infarcts, so you also get adrenal insufficiency and diffuse intravascular coagulation, rather disseminated intravascular coagulation, DIC, and again, that goes with the septic spots that you see from the little hemorrhages all around the body. So that's basically what we have to know about meningitidis. The only other thing to remember is that clinically, something that's going to happen on the test is they're going to tell you that there are breakouts in the military barracks, in a dorm room, or in a prison. Basically, close quarters, closed environment, between a lot of people that could potentially be getting sick from this. That basically sums it up for gram-negative cocci, a really very easy group of bugs to remember. Before we get to the gram-negative rods, we're going to talk about those hybrid bugs. They're not quite cocci, they're not quite rods, so they're the coccobacilli. The most important one out of this group to remember is Haemophilus influenza. And there are a couple other ones that we're going to talk about, but they're going to be very, very obvious based on the clinical picture. So we're talking about Haemophilus, we're talking about Pasteurella, which again causes cellulitis after an animal bite. We're talking about Brucella, which we're going to be talking about undulant fever after somebody who comes back from, let's say, South America, where they had cheese from the cow on the mountain that didn't come through an industrialized process. In other words, it was unpasteurized. So unpasteurized dairy, unpasteurized cheese. And we're going to be talking about Bordetella Pertussis, which, again, is one of these coccobacilli, but it has a very, very typical clinical presentation. You're talking about, again, an unimmunized kid with this whooping or seal-like barky cough. So again, pretty obvious based on how they describe the presentation to you. So the big one we're going to talk about right now is Haemophilus, and it's got a couple of these factors that are very, very testable on the step one. So number one, it does have an IgA protease. It makes sense, again, when you think about meningitis, and you think about strep pneumo, and you think about Haemophilus influenza. They all have a pretty similar pattern of infection. Respiratory droplets get in through the lungs. They can get into the blood system and sort of disseminate and get to the meninges and other areas like that. So again, Haemophilus influenza in kids, it can cause pneumonia, it can cause otitis media, it can cause epiglottitis, it can cause sinusitis, and it can cause meningitis. So we're thinking about all the same types of infections over and over again. So a couple things to remember about this guy. It needs to be plated on chocolate agar, which again is boiled blood. Haemophilus, again, meaning blood-loving. And the reason why is because it has factors V and X, or 5 and 10, however you remember that. And so again, we spoke about the diseases that it causes, including otitis, meningitis, pneumonia, and epiglottitis. So that is going to be the gist of Haemophilus that we need to talk about. So again, we mentioned the other important coccobacilli, Pasteurella, Brucella, Bordetella, and that leaves us with the gram-negative rods. Now, the gram-negative rods is a pretty big class of organisms, and I'm going to discuss it with you in this way. We're going to talk about the gram-negative rods that affect the gut, be it either in food poisoning or in some kind of gastroenteritis. And then we'll talk about other gram-negative rods. So when we start talking about gram-negative rods in the gut, the key difference that we need to know about them is going to be whether they ferment lactose or not. And the way that we tell, again, because we're going to be using the microbiology to construct a decision tree to identify an unknown, the first thing they're going to do is they're going to take one of these gastroenteritis causing bugs, and they're going to put it on a McConkey's agar. And McConkey's agar has got lactose on it. And basically, if a bacteria is able to ferment the lactose, it's going to form a pink colony. And so on the next slide, I've included a picture of McConkey's agar. On the left part of the agar, it's plated with a lactose fermenting bug, and it's pink, and pink goes with positive, again, playing on those P's, right? So that's a lactose positive bug on the left, and on the right, they're lactose negative. It's just a regular, like, bland, yellowish, beige kind of picture. So that's going to be the key to determining what kind of bugs we're talking about when they're affecting the gut. So let's talk about the Enterobacteriaceae, which is a fancy way of saying bugs in the gut. Remember, entero, E-N-T-E-R, that prefix means intestines. So we have to know a couple of their antigenic properties because that's very testable in the step one as well. Obviously, it allows a lot of integration between the microbiology with the pathology and the immunology if we understand something about their structures and their antigenic properties. So the Enterobacteriaceae have got 3 important antigens that we need to know about. There's the O antigen, which is the particular polysaccharide antigen as part of their endotoxin, or LPS. You can just think of it as being the unique fingerprint of that bug on the LPS molecule. The H antigen is present on the flagella, which not all of them have. Some of them have got flagella and some of them don't. The K antigen is present on the capsule. And I just, again, play with that K sound. So in my head, I say K is for capsule. If you pretend that capsule starts with a K, it also helps me remember that Klebsiella, also starting with a K, is encapsulated. and it's also a gram-negative rod. So, you know, it's easy to think of these patterns to just let them work for you rather than work too hard memorizing. So when we start talking about lac fermenters, meaning lactose fermenters or lac non-fermenters, let's just remember the lactose non-fermenters. And why do I say that? Because that's a smaller group, and the lactose fermenters is a much bigger group. So if we just try to remember the lac non-fermenters and assume that everything else ferments lactose, it's a pretty safe way to go about doing it. We save how much memorization we actually have to do. I think it makes it somewhat simpler. So let's talk about some of the lac-negative bugs. Our Shigella, Salmonella, and Proteus. And by the way, they are all oxidase negative. So we have to know something about differentiating between these bugs. And it's convenient to know that they do have a couple of very specific differences. So Proteus, which I just mentioned, it has swarming property on sheep blood agar. So that's going to be something they tell you that, you know, they isolate this bacteria and they plate it on blood agar and it just swarms all over it. And that is going to be a giveaway for Proteus. So when we talk about Shigella versus Salmonella, we have to know a couple things. Number one, Salmonella produces hydrogen sulfide. And so what happens is we plate these bugs to tell them apart on that, remember that greenish blackish agar that you learned about in microbiology? It's called the hectone agar. You don't have to worry too much about trying to memorize that word. But the point is that if a bug produces hydrogen sulfide, it's going to turn black on that agar. So Salmonella is going to turn up as a black colony. Shigella doesn't. So it's just going to be a green colony on that agar. They also cause very different clinical diseases. They both can cause gastroenteritis. Shigella obviously causes bacillary dysentery, so it's going to cause a bloody, mucousy, violent kind of diarrhea. Salmonella may or may not have a bloody diarrhea, so it could just be, you know, run-of-the-mill, typical, watery kind of diarrhea, or it could be bloody. But Salmonella also can cause a couple other things. It can cause typhoid fever. And the reason why it's called typhoid fever is because it resembles typhus. And typhus, when we get to the rickettsial diseases, was one of those diseases that affected, you know, the soldiers in World War I when they were living in the trenches, and they had fleas and ticks that are, you know, just munching on all of them when they're living in the trenches for weeks to months at a time. And it causes this nasty fever, flu-like syndrome with this really nasty rash. So typhoid fever is so named because it resembles typhus. And on the next slide, I've included a picture of typhoid fever and a couple of things to notice. Number one, the person is actually wearing one of those masks, an N95 respirator mask, right? And he's probably, you know, he's contagious, so you just want to cover this guy's face. He also has got a very characteristic rash on his chest, and these are called rose spots. So I've pointed them out over here. They're the rose spots of typhoid fever. Again, that's why it resembles typhus, and hence the name. And on the right side of the screen, I've included a stool sample that was then put under microscopy, and we see the characteristic signs of bacillary dysentery. So bacillary dysentery has to necessarily have blood, and it has to have pus, basically white blood cells. And we see both of those things on this smear over here. Moving on, we also have to remember now E. coli. So there's a couple of different types of E. coli, and their syndromes vary slightly depending on which type of E. coli we're talking about. So I'm just going to briefly go over them. They're all E and then a letter and then EC. The first E stands for entero, the last EC stands for E. coli, and then that missing letter in the middle stands for something else. So first of all, there's enteroinvasive E. coli, which causes dysentery. There's enterohemorrhagic E. coli, which causes hemolytic uremic syndrome and thrombocytopenic thrombotic purpura. And remember that one comes from O157H7 antigen. There is enterotoxigenic E. coli, which causes traveler's diarrhea. There are some other garden variety types of E. coli, which includes enteropathogenic E. coli. And this causes a diarrhea, but it's not a toxic effect on the bowel mucosa. It's really due to malabsorption, which causes then, you know, sort of an osmotic diarrhea. And that's more typical of diarrhea in kids, this EPEC, that EPEC. There's also EUEC. I just remember U for urine. It's uropathogenic. And that causes UTIs, and it can progress to pyelonephritis. And the thing to remember about that one is it expresses a fimbria, you know, these finger-like molecules that will allow it to grab onto the urinary tract and sort of climb up. So even though the urine normally flushes bacteria down the urinary tract, and that keeps from UTIs moving retrograde up to the kidneys, EUEC is going to be able to kind of climb its way up to the kidneys, up through the ureter, and then cause a pilot that way. So that's pretty much it for E. coli. Another thing to remember is that the serotype K, its antigen, is one of the things that allow it to colonize the meninges. So that's going to be a buzzword for E. coli meningitis in a neonate. So just remember that, serotype K, or you may see serotype K7. The next bug that we have to talk about is Yersinia. And Yersinia is kind of interesting. There's two bugs. So one of them is relatively higher yield, and one of them is relatively lower yield. But I'm going to mention them both. There's Yersinia Enterocolitica, which is very interesting because enterocolitica, as it sounds, it's in the intestines, it's in the colon. It causes diarrhea, but it's going to present like appendicitis. There's going to be this intense lower right abdominal quadrant kind of pain. And you have to be very aware of one thing that's going to be very interesting. Pets, actually, are going to be the vector for picking up this bug. So you may get something in the history like this. Here's a kid who's coming in with something that looks like appendicitis, and he has this diarrhea, and he has a puppy that they got a puppy like a week or two prior. So try to pick up on that, and that's going to be a pretty interesting catch if you can get that in step one. The other Yersinia bug that we have to remember is Yersinia pestis. And Yersinia pestis causes bubonic plague. So the picture we're going to get of a Yersinia pestis infection, first of all, is you have to remember where it is. We still have it in the southwestern United States. So if you get a question where there was somebody who just came back from camping in Arizona, and they have this flu-like illness with high fever and a painfully inflamed, swollen, and exquisitely tender lymph node in the inguinal region, this is going to be classic picture of bubonic plague. Basically, that lymph node is a bubo. It keeps growing, it becomes more and more inflamed until it literally just ruptures and bursts through the skin, and it creates a sinus tract and drains. It's a really, really gross thing, but you can get it on the step one, and it's a fun catch if you do get it, because you'll see like, oh, that's bubonic plague, I just picked up on that. The other thing to remember is that its vector is actually in prairie dogs. So that's one of these obscure kind of facts, but try to remember that one. Two more kind of bugs that we have to remember for the gut infections, the gram-negative rods. We have to remember H. pylori. So there's a couple things to remember about it. It's urease positive. It is associated with ulcers. Vast majority of duodenal ulcers are due to H. pylori, and a significant proportion of stomach ulcers, gastric ulcers. It's also associated with two types of cancers. There's adenocarcinoma in the stomach, as well as gastric-associated lymphoma, the Galtomas. So we do like to try to diagnose H. pylori infections and treat it pretty quickly. So, whereas we don't really go into the exact treatment for a lot of these infections, but the step one is absolutely going to want you to know what the treatment is for H. pylori. And you have to know this. It is triple drug therapy. So what does that mean? It's 2 antibiotics and something to cover the stomach mucosa, basically to protect it from its own acid at the site of the ulcer. So which antibiotics are exactly? Don't worry about memorizing it. It's going to be fairly obvious. It's going to be something like metronidazole or a different antibiotic. And again, remember, metronidazole goes with flagella. Remember that H. pylori has got flagella. And the thing that's going to be used to protect the stomach, it's either going to be something very, very obvious like bismuth, which is Pepto-Bismol, or it's going to be a PPI, like omeprazole. So remember, triple therapy, and that's the treatment for H. pylori. I can almost guarantee you're going to get a question on that. And the last group of bugs that we're going to talk about that affect the gut are the comma-shaped bugs. So which are the comma-shaped bugs? First of all, they're oxidase positive. They include the Vibrios species, and they include Campylobacter. So the things we have to know about these guys is that the Vibrios typically come from seafood because, usually it's shellfish or shrimp or something that was caught in dirty water. In other words, it's fecal-oral transmission, but it can very easily be passed along in seafood because it's not cooked very well. It doesn't totally kill these bugs. And they grow in alkaline media and in high salinity. And that's going to be how you tell these guys apart from Campylobacter. Campylobacter does not grow in alkaline media, it does not grow in high salinity, but it does grow at high temperature. It grows at 42 degrees. And there's a couple other things we have to remember. Vibrios, they cause intensely watery diarrhea. It's actually potentially life-threatening. For example, if you think of cholera, there's so much diarrhea that there's total volume loss. And basically, you get so dehydrated that your blood pressure plummets, and then you die from that. So the treatment for cholera is just fluid resuscitation, basically. And Campylobacter, another thing to remember about Campylobacter is it's the #1 bacterial cause of diarrhea. It also may or may not be bloody. And when you get a picture of Campylobacter, it's actually going to be pretty easy to recognize because you actually see two of these spirally shaped bacteria that are connected to one another, and it looks kind of like a V or like a seagull flapping its wings. And that's how you recognize Campylobacter, right? Like a seagull. Just try to remember that. So that pretty much sums it up for the gram-negative rods that affect the gut. And now we're just going to go over a couple other ones really quick, sort of the gram-negatives that we didn't quite catch. That includes Legionella, Klebsiella, and Pseudomonas. So what do we have to know about these guys? Legionella, gram stains very weakly, so we really use a silver stain to pick it up. Legionella, you should think about water sources. So, somebody is going to be either hanging out in a hot tub, or they work in a water tower, or there's a ventilator that's been getting a whole floor full of people sick in the hospital, or there's an air conditioner that's getting everybody in the apartment building sick, things like that. So what does it cause? It causes Legionnaire's disease, which is basically a very serious pneumonia, and it can also cause Pontiac fever, which is, kind of non-specific flu-like illness. So you have to pay attention to the history, because again, you're going to get something like this body of water that allows it to grow. The other thing we have to remember about Legionella is that it grows on charcoal yeast extract and it needs cysteine for growth. So next we have Klebsiella. Klebsiella is also an interesting bug. It does grow in the gut. It also causes respiratory disease, which means it has to be aspirated. And if you think that it has to be aspirated, then it makes sense who's going to get sick. Somebody who's very drunk, right, because they are vomiting and they inhale a little bit of the vomit. Maybe somebody who's having a seizure, because again, they could be foaming in the mouth, vomiting a little bit, and inhaling a little bit. And the other thing to remember is diabetics. They also get Klebsiella pneumonia. So, the classical picture is one of these people, diabetic or alcoholic or somebody with a seizure disorder, and they have a pneumonia with rusty colored sputum. Klebsiella, by the way, also can cause UTIs, just to keep that on your differential. Lastly, we have Pseudomonas. Remember that Pseudomonas is aerobic, right? So we have to remember that. It has its blue-green pigment, this grape kind of odor, and it is lac negative, which we already mentioned before. It inactivates elongation factor 2 with its toxin, and it causes just about every kind of infection you can think of. It causes otitis externa, that's swimmer's ear. It causes pneumonia in people with cystic fibrosis. It causes osteomyelitis in people with diabetes. It causes UTIs. It causes hot tub folliculitis. And it causes eczema gangrenosum, which are septic necrotic spots of the skin from bacteremia. Kind of like when we were thinking about meningitis and you get those septic spots. So very similar. Now that we've covered all the gram-positive and all the gram-negative bugs that are very high yield on the step 1, let's just mention a couple other things that just to tie up some loose ends really quickly. We have to know that there's a whole bunch of bugs that are aerobic, right? And they are by default going to be causing pulmonary infections because they like high oxygen tension. So you have to think of Pseudomonas, right, in people with cystic fibrosis, Nocardia asteroides in people who are immunocompromised, tuberculosis in people who could be healthy or immunocompromised, and anthrax, right? All these guys cause nasty, nasty pneumonias or respiratory infections. They're all aerobic. We have to remember anaerobes, and the easiest way to remember that is ABC, Actinomyces israelii, Bacteroides, and Clostridium. And they all do something a little bit different, but the key point, because they're anaerobes, they're going to have the classic thing. The key point to remember is that they smell bad. Actinomyces causes dental abscesses, so we have to remember, people with really nasty breath. Bacteroides causes abdominal abscesses. Basically, it's gut flora, but if it gets somewhere into the abdominal cavity, it's going to cause these foul-smelling abscesses in the abdominal cavity. Clostridium causes foul-smelling diarrhea, right, if we think of Clostridium difficile. Okay, so that's the anaerobes. Let's remember also the urease-producing bugs. So we have Proteus, which we've mentioned, causes UTIs. We have ureaplasma, which is Mycoplasma's cousin. It causes non-gonococcal urethritis. We have Klebsiella, which we've just briefly discussed, a little bit about the fact that it causes UTIs as well as pneumonia. And we have H. pylori, which, you have the urease test, which is classic for the diagnosis of H. pylori on the step 1. And then let's also keep in mind that not all bugs can be gram-stained. So we mentioned already a couple things. Bugs that have strange cell walls, for example, if they don't have peptidoglycan, for example, mycoplasma or ureaplasma. And we even mentioned a moment ago, Legionella needs a silver stain. There are also a couple of the other ones like spirochetes, chlamydia, the, intracellular bugs like the rickettsial diseases. They cannot be stained with gram stain, so they need to be visualized another way. And that's really going to be our segue into our next lecture where we talk about some other bacteria that you cannot visualize with gram stain alone. So until then, thanks for watching.